Hey guys. All right, I think we're good.
Can you see me? Hello, Dr. Yemi.
Yes, Anthony, I can see
I can't see myself. Why?
you.
Anyway, if
But
you can see me and others can see me, that's fine.
yeah, I'm gonna confirm real quick from someone to see if they can see you.
Okay, I think someone is saying they can see me. Not sure. Can you hear me? Am
Yep,
I
very well.
okay? So we'll be
Awesome.
on in
Right now,
five,
Aisha.
4, 3, 2, 1. Can we start?
Yeah.
Dr. Yemi, good evening from here.
Good evening
What
from
time
over
is it
here.
over there?
It's
Huh?
2 p.m. 2 p.m.
2 p.m. Wow, okay, that's good afternoon. Thank you for honoring this invitation. I really, truly appreciate it. And God
Of
bless
course.
you.
Done.
Okay, let's go straight to the business of the day. Okay, Dr. Yemi, first of all, can you briefly tell us what sickle cell disease is so that we can now know what we are talking about? Just tell us briefly.
So, sickle cell disease is a constellation of it's not just one disease actually. It's a constellation of diseases that come from um, a an abnormal red blood cell that's caused by a that's caused by a genetic trait. And when this genetic trait, I'm trying to explain this in the most layman terms and as much layman terms as possible. When one has two um, two sickled traits to make the SS genotype, then you'd have the sickle cell disease. A lot of people have just one of the uh, for lack of better layman terms, one of the traits. These are the people that are AS. But when two people that are AS come together and have uh, and possibly have someone who is SS, then that SS person has a sickle cell, would have the sickle cell disease, which is a constellation of diseases that can come from that sickle cell trait. It's an abnormal red blood cell, and that's where the name comes from. The fact that the red blood cell can be abnormal, have a sickle shape. And the sickle is just the word from, I don't know if anybody knows this, this thing you used to do gardening called a sickle.
Yes.
So you
Yes.
take that sickle is like a scissors. If you take one of the sickles out, that shape it has, that's how the red blood cell becomes shaped because of that disease. Um,
Okay.
and it's because of the abnormal hemoglobin in that red blood cell. I don't want to go too much into it. The important thing is to know that the abnormal shape of that red blood cell makes it such that blood flow is abnormal, and blood flow can become blocked because of that abnormal red blood cell shape.
Okay.
And then you have all kinds of diseases from kidney disease to bone disease to stroke, all kinds of disease. And this is what makes up sickle cell disease, basically.
Okay. Um, can you tell us why blood donations are critical for people with sickle cell disease?
That's a good question. This is because one of the main manifestations of sickle cell disease is the anemia. That is sickle cell
Okay.
anemia. Because those blood cells are bent like that, a lot of red blood cells will be broken down, and as such, someone that has a sickle cell disease would have tendency to go into anemia often. And when this happens, they would need blood transfusion a lot. Some can need a lot of blood transfusions. Some people do go a long time without having a blood transfusion, but a lot of times there's need for a blood transfusion. So We will need, as a country that has a high um, um, incidence and prevalence of sickle cell disease, we need our blood banks to be stocked with blood to make available for people who need, these people who need them.
Okay. Okay, that's Nigeria. You are speaking about Nigeria now, right?
Nigeria, yes, Nigeria is my country.
Okay. What is a red blood cell transfusion? Red blood cell
Red blood cell
transfusion.
transfusion, yeah, that is basically what it is. Um, to make it such that people know why it should be differentiated, there's whole blood transfusion, which has all the other components of blood, you know, white blood cells, platelets, and plasma and everything that is in the whole blood. Well, red blood cell transfusion means that they've taken that component, the red blood cells out. They've, you know, to put in a common term, they've condensed the red blood cells out and taken all the other components away. This is important because you want to be able to reduce the risk that come from, you know, giving whole blood and be able to effectively increase the hemoglobin content of the blood by giving just the red blood cell transfusion. So usually it's called packed cell transfusion, and the name comes from just that the red blood cells are packed and separated from other components of the whole blood.
Okay. Okay. That's for those who give blood, who donate blood. Are there special requirements?
Not so much as requirements for when you're donating blood, as much as what the people who are storing the blood bank needs to do to, and what the doctor needs to consider when transfusing the blood. And what do I mean by this? To go straight to the specific question you asked, when you're donating blood, just you're gonna go through the regular steps you go through when you're donating blood. Make sure you're fit to donate blood. Make sure you follow the guidelines they give you at the blood donation center. You do the things they ask you to do after donating blood. But as far as sickle cell disease itself goes, the blood, the things to consider are that we want to avoid blood transfusion as much as possible, because there's also something called iron overload, and there's also the fact that each time you take a blood transfusion, you're exposed to the risks of blood transfusion, and those risks are including but not limited to infection with any bloodborne diseases, iron overload for sickle cell disease people, because when you take a lot of red blood cells have a lot of iron, and you can have iron overload from that. So these are the things that one should consider generally when it comes to blood transfusion. But our doctors are very good at considering these things, and they're usually on top of it.
Okay. Okay. I'll ask this question now, then we'll take, I think I can see 2 questions from our viewers. Can sickle cell patients donate blood? I'm asking this question because I am a sickle cell survivor, sickle cell carrier, anyhow, but my blood group is O positive. So is it possible for me to donate blood?
Technically speaking, yes. But is it clinically recommended? Like, can I clinically recommend that? No. Because as someone that has sickle cell disease, there's something called your stable state hemoglobin. You want to keep that. You want to keep that up, right? So, for the general population, blood donation is good. It's good for you to donate blood in the general population, because blood donation helps keeps your bone marrow active, and it keeps you, effectively speaking, keeps you young. But for sickle cell disease patients, I would not recommend blood donation. your doctor would not recommend it either. So that, I guess that answers that question.
Of course it does. Okay, let's pick one of our viewers' questions. Okay, someone is asking, for patients who have children with sickle cell anemia, what can they do to help manage their condition?
Great. This is a very good question, because a lot of people, the first thing people do tend to do is to, be worried, panic, and, want to, just consider all the negatives. But there are a lot of good things that you can do, a lot of actions that can be taken. And this is a segue for me to go into what I mainly want to encourage everybody with today, which is the role of primary care in sickle cell disease management. It's very important. So, to answer the question directly, first of all, first thing to do is to establish care with a doctor, with a primary care doctor. Have your own doctor that you go to for follow-up visits, because the things that need to be done in the sickle cell disease patients are not things that you can do in a once a year visit, or in a one-time visit. So that's the first thing, to establish care with a doctor. Make sure your child has a doctor that they go to often. Maybe it's every 3 months, 3 months appointments, every 6 months appointment. And the next thing I would encourage you to do is to adhere to the guidelines that they give you. And these guidelines would include things like, they'll tell you to make sure your kid is well hydrated. Make sure your kid drinks a lot of water. They'll tell you to make sure your kid is not exposed to stressors. And when I say stressors, I mean being overly exposed to heat, like on being out for long periods on hot days. Avoid that. There is something we used to make jokes about back in medical school when it comes to management of sickle cell disease. We typically would tell sickle cell disease patients not to go partying so much. It's not because we want it's not because we want their quality of life to reduce. In fact, the opposite. We want them to have good quality of life. But when it comes to dancing for long hours, then that's a major stressor right there. That could tip one into a crisis. And what's the takeaway from this? Takeaway is not that you should not dance. Please dance as much as you want, but you have to avoid long periods of being stressed without resting or staying hydrated. If you're going on a long walk, unlike other people, you have to stop and take a rest and stay hydrated during that long walk. Another thing is make sure your immunizations are up to date, and make sure that the supplements that needed to be taken are taken, like folic acid and other multivitamins. Yeah.
Okay. The second question, is it medically possible to change the sickle cell genotype?
So this is a very good question, and there are cutting edge interventions that are available now. And the main one is something called hematopoietic cell transplantation. This means that precursor cells, there are cells that divide up to form our red blood cells, and they are in our bone marrows mainly. Some of them are found when we're very young. Some of them are found in our spleen. Some of them are found in, I think, places like called the thymus. But the main takeaway is that those precursor cells can be gotten from someone who doesn't have sickle cell and transfused into someone who has sickle cell, so that those cells can be producing normal red blood cells for the person. I don't have at hand right now how long that treatment lasts, but it's something that is potentially seen as a cure for sickle cell. This is not me saying to you directly right here that there's a cure for sickle cell, but there is a treatment, and that treatment is that hematopoietic cell transfusion. I don't know how available it is in Nigeria. I don't think it is available yet. I'm not sure.
Okay. Someone is asking a question that is relating to this last one you answered, but I think I know where the person is coming from, in the sense that, okay, let me ask the question. The person is asking, is it possible for someone's genotype to change? As in, Okay, let me give you a live example. I know someone who got married, and herself and her husband were not sickle cell carriers. They were not carriers. They were not sickle cell patients, but they
Mhm.
gave birth to a sickle cell child. How is it possible?
First of all, I should mention that genetics is a I want for the lack of a better word is a wonderful thing. There are people who have had children who've had different who carried different genes that they supposedly carried. So anything is possible in that sense. Um, but I should also let you know that most of the time when that kind of thing happens, most of the time it's because um, unfortunately it's related to infidelity. But there are times,
Are you
unfortunately,
kidding
yeah, there are times that these things have happened when there was no infidelity and the child is rightfully was made by both parents and there was no outside party involved. But most of the time when we see things like this, unfortunately, that's the answer.
Okay. Before we take other questions from people, let me ask this.
Mhm.
Now, during the sickle cell awareness month, like this now, September,
Mhm.
how can people help contribute their quota for sickle cell patients? Some
Yes.
people will say, I wish I can do something. I would just want to donate blood. And what else? What can they do to help sickle cell patients?
Raise awareness, increase awareness about the disease, not treat people that have sickle cell disease like they're so different. Um, the biggest problem with diseases like sickle cell disease and type 2 diabetes, these are among the common diseases that start from a young age and make young patients start to feel like they're not, and it can have a behavioral or psychological effect, which will worsen the prognosis. Because once the
Yeah.
patient has sickle cell disease or type 2 diabetes and they're having behavioral or psychological psychiatric diagnosis associated with it, the prognosis worsens. So this brings me to back to your question. Increase awareness in letting people know that there are things that can be done. This is not a death sentence for this person. Don't treat the person like, oh, maybe you're gonna die young, or there's no hope for you. So increase that awareness there. And the second thing I want to tell people to do during this kind of awareness period is it's something I'm calling out to all Nigerians. I'm calling out to everyone to normalize going to your primary care doctor, even people who don't have sickle cell disease or sickle cell traits. We don't have very good follow up culture in the medically speaking, in Nigeria. We don't have that, and that is going to improve the prognosis of a lot of illnesses all over the world. People are going to primary care model, and this is not new in Nigeria. Back in the 70s and 80s, Professor Ransom Kuti, Fela's brother, um, with the help of some other people, set up a primary care model in Nigeria that was very helpful. There was a primary care clinic in every community in Lagos, and it made
Good.
people have access to seeing doctor for hypertension, diabetes, and this prevented the complication of all those diseases. And among these things, the sickle cell disease. And once you have a doctor that you can go to every month, every 3 months or so, that is going to tell you what to do to prevent crisis, tell you, give you travel advisory. I'm traveling here, I'm traveling there. Oh, you should take this immunization before you go to that place, or you should do this, or maybe it's not advisable to go there. It's hot at this time of the year. Those things are going to prevent things like people going on trips and having a sickle cell crisis on the road and not having an emergency room to go to and dying. I know someone who died that way from sickle cell disease, you know. So normalize, to answer the question, back to what you were saying, normalize seeing your primary care doctor often for follow-up.
Okay. So, in other words, I think Nigeria should increase their primary health care centers, right? Because I think that is like the least or basic kind of health care that even those in the rural environment can afford,
Yeah,
isn't it?
yeah,
Okay.
absolutely. And it's the most affordable, it's the most effective in preventing mortality from diseases. So
Oh,
yes, so it's funny that
how so?
we focus on all the highfalutin stuff. We want to have all the latest gadgets and all the latest technology for healthcare, which is great. We should have all those things, but we should spend more time and energy focusing on improving our primary healthcare.
Yes,
That's
yes.
that's and this doesn't only depend on the government, it depends on Nigerians as well. Because, for example, there are parts of Lagos where there are still primary healthcare centers. People don't utilize them. Some doctors are posted to these places as corpers. They don't see patients. Nobody comes to those places because nobody wants to go to the clinic if they don't
Will
pay.
you blame
They
them
want to go to the
when
emergency
you
room.
see the environment alone? What
It's
will
true.
take
You're
you
right.
there?
You're right. For someone
I'm
like me,
sorry,
when
but
I
I won't
was
say
during my NYSC, I made sure I know I declined a job that was paying what about 200 over 200,000 naira per month, and to go to a job that would pay me 50,000 naira per month because I wanted to serve in that, you know, in that kind of community, you
yeah.
know. So
Wow.
it's doable, something we should think about and focus our energy on.
Hmm. Okay. Our next question. As a doctor, now this one is personal. As a doctor, what's the worst sickle cell case you have handled before? Just tell us as it is, you know.
Um, this was a long time ago. It wasn't in the US. In the US, the sickle cell cases are managed where people who come in, they have good follow up. They came in because they were in pain crisis, and there's already a care plan for them, and we just start that care plan. We have all the, everything is already, you just started, and they get better over a couple of days. If they're not getting better, then we'll start to investigate if there's a complication that we're not thinking about. Now, to answer your question, the worst cases I've managed were back in Nigeria, and usually, well, what I consider the worst case, I've seen people that had acute chest syndrome from it. That one is fatal because they can die in one day. It happens very fast, affects the heart, affects the breathing, and it can kill a patient very fast. But what I consider the worst is when they have what is called the avascular necrosis of the head of femur. What this means is the thigh bone has a head that locks into the socket in the hip for everybody. Now that head of that thigh bone is like a ball that locks into that socket, right? The blood uh, supply for that head is tricky because there's a larger blood vessel that comes one way and there's a smaller blood vessel that comes another way. Now, if that larger blood vessel gets clogged, or even both get clogged because of we talked about the how sickle cell works the other time, right? Because of the shape, it blocks blood vessels, right? Now,
Okay.
the head of that ball can
Mhm.
start to gradually erode away because it's not getting a lot of blood supply. And it's
Wow.
so sad what happens afterwards, in the sense that sometimes it's not caught for a long time because it won't be very bad pain. It'll just be like chronic pain in the hip, and it may be mild pain. And a lot of times these kids just say, "Oh, I've been having this pain," and they continue to limp and limp for months, and that bone just erodes away. When I've seen them in the hospital, and they just sometimes they're not able to walk again. Sometimes it takes a long time for a viable option is gotten for them. It's just really sad. Their quality of life goes down very fast, and that is the part that's the part that saddens me. That makes me feel like those are the worst cases that I've seen. So to answer your question straightforwardly, the worst ones I've seen are from avascular necrosis of the head of femur. Even though it's not the worst, it's not even in the top 3 of the worst things that can happen with sickle cell disease.
Okay. Speaking sincerely, I'm a sickle cell patient, but I've not heard of this before. Seriously, I've
Yes,
not.
and that brings me to talking about the possible things that can happen from sickle cell disease, that possible complications, and these complications can be divided into different types of things that can happen. Now, I was talking about how the blood vessel can be clogged. That can cause vaso-occlusive crisis. And what this means is that, for example, a bone is not getting blood supply and there can be severe pain. The pain is really bad. It's one of the worst pains a human being can experience when that vaso-occlusive crisis happens. The pain can be acute, can be chronic. There can also be infection because sickle cell disease patients, there's something called um, um, I'm even blanking on the proper name now, called splenic sequestration. Basically, to say it in layman's terms, the spleen, which is very important for infection control for us,
Yeah.
kind of just gets smaller and smaller. And as sickle cell patients get older, a lot of times they don't have a spleen anymore, and they don't have
Wow.
that good. They don't have a good ability to control the infection as well as other people, so they can have severe infection. Yeah, so that's one of the complications that can happen. Another thing is we've talked about is anemia. Anemia can happen. There can be multi-organ failure, often starting from the kidneys. There can be stroke because it changes sickle cell disease, because like the blood vessels can change how the flow of blood is. It can cause a stroke. The stroke can be from blocking the blood vessels, can be from the bleeding in the brain. So these are some of the things that can happen, and a lot of times there are some things that we've not even heard about. A funny one, it's not funny at all, but
It's not. It's not.
it's not funny at all, but one that is weird, that is, we don't often think about, is something called priapism. Priapism can happen from other things, but can also, sickle cell disease patients are prone to it. And this priapism is simply or plainly described when there is a penile erection that just won't go down and can cause.
Oh, I think Dr. Edwards said something about this
Yes.
the last time.
Yes.
Oh,
The nature of
okay.
it makes it sound funny, but it's not funny at all. They can lose function of private organ from that. Yeah. It sounds scary, true. I see Fumi saying that all this sounds very scary, true. But the point of this is not
It sounds scary.
it's not to scare anyone. It's just to
reality. It's just the reality, I think.
yeah. No, and it's not just saying what is reality. It's saying why it is important to follow up with your doctor, okay, and adhere to the things that your doctor asked you to do. Someone asked a question earlier and said, "What's the difference between SS and SC?"
Yes.
So SS is the more common form of sickle cell disease. The SC is a not so common form, but they have the same. They can have the same. They look the same, basically. Now SC is mildly different. Some have said it's worse. Some have said it's better. I'm not. I don't. I'm not. I'm not. I don't care so much for which one it is. The fact is that it can cause the same problems. Now it's seen more, the C genotype is seen more in the western part of Nigeria among Yoruba people. So it's possible for a person to be AC. You know how people say, "Well, what's your genotype?" and people think you're either AA, AS, or SS. You can be AC, you can be SC. I've not heard of someone who's CC though. I don't know if that's cool, like, but so that's the difference between SS and SC. If someone's asking.
Okay, but SC patients, sorry, they also experience crisis, do they?
Yeah, yes,
Okay.
they're effectively
Okay.
managed as sickle cell disease patients.
Oh wow. Okay. Are there particular foods sickle cell patients should eat? That's another question to help boost their immunity, to boost their immune system.
So
Are there particular foods?
before I come back to your question, I want to answer the immunity part first. So this
Okay.
the reason the effective thing is to get your immunizations. For sickle cell patients, immunizations have to be up to date. And some of the important immunizations that have to be up to date are your pneumonia shots, your
Oh, wow.
PCV 13 and 23, um, as kids and as adults. I'm not remembering right now. I think you have to repeat one of them even as an adult, even if you got both as a kid, as a child. Another thing is that if a sickle cell patient is found not to have a spleen, maybe your doctor examined you and sees that as a baby or as a growing child, your spleen is getting smaller or is disappearing, they may put the person on daily antibiotic for the rest of their life. Another way to do is just to take the antibiotic in periods of time, every now and again, and it's usually penicillin. Um, Now, to answer your question, what are the things you can do to prevent? Just eat healthy. You can eat foods, regular foods like everybody else. Um, some people say eat foods that are rich in iron for your blood, but I subscribe to that so much because the chances that a sickle cell patient is going to get blood transfusions is high, and they're going to get a lot of iron from this blood transfusion. They don't need to continue to stock up on iron by themselves.
Mm-hmm.
So the important thing is for you to take your folic acid, take your other multivitamins, um, and eat healthy. Drink a lot of water. I guess that's the answer to the
Okay.
question.
Okay. I think that iron part, I was actually told not to take things on
Hold on.
iron. I don't.
Someone asked a question, and I'm missing the questions as they're coming. Okay, someone said my
Um,
genotype is AS, but my doctor referred to me as sickle cell carrier. Please explain. So we've talked about this earlier, that you can be a carrier and not have the disease. Being a carrier doesn't mean you have the disease. If you're a sickle cell carrier, you're AS. You are like a regular person. There's a theoretical risk of having kidney disease, but
wow.
you this doesn't most of the time. I'm AS as well. We AS people usually don't have any problems. Well, the only thing we need to consider, or the main thing we need to consider, is genetic counseling. And now you should see your doctor for proper genetic counseling. The reason is not because people in the street or your family members don't know about genetic counseling, but for genetic counseling to be proper, it should come from the healthcare provider. And what this means is that the main topic in genetic counseling is basically who you marry or who you procreate with,
Okay.
who you have children with. Okay,
Yeah.
so avoid having children with someone who's AS because there's a 25% chance that you have an SS child.
Okay. Okay. Another question here. Does sickle cell affect the male gender differently from the female gender?
Not not very not the difference is not the main complications are still the main complications. The difference is there's not a lot of difference. Maybe a female is not prone to priapism, but not really affects them the same amount. The male child can get it as much as the female child can get it. I see Busaya is on here. Busaya is asking about a rhesus factor question. I think we missed that question. Someone asked about rhesus
Yeah.
factor.
Where does the resource factor come in?
So the resource factor is not coming very much when it comes to management of sickle cell disease. Resource factor comes in when it comes to childbirth, because if a woman who has a different resource factor from her baby, if a woman has a different resource factor from her baby, there can be antibodies that are created that are going to affect the next baby. That's the main gist of resource factor. That's the main reason why we care about resource factor. But when it
Okay.
comes to sickle cell patients, it doesn't really come into play. Someone asked another question and said, why my doctor asked me to take folic acid daily, progranil daily, to prevent the frequency of crisis. The folic acid is going to help. Is going to help your body create normal red blood cells. And what affects whether or not you have crisis is the ratio of normal red blood cells to abnormal red blood cells you have. So that's the reason why it's important to take the folic acid.
Okay.
The reason why you're taking the progranil is to prevent having malaria. Wait, hold on. Is that progranil?
Okay.
I'm forgetting these medications. I believe that's progranil is yes, I believe that's what it is. If I'm wrong, and someone should
Okay.
correct me. Yeah.
Okay. Someone is asking, what genotype comes together to produce SC?
AS and AC.
AS and AC.
Or SS and AC. Or SC and AS.
Wow.
Or even
Oh.
or even SC and AA. Yeah,
Wow.
it's a bunch of there are a couple that can come as far as there's a C in the mix. Now I wish I had prepared a chart that shows how people who are AS or people whatever genotype someone is, the chances that they can have an SS child. There's a straightforward chart that we use to show patients what can happen. And you know how I said earlier that there's a 25% chance of having a child with SS when two AS people, having a child. That chart would have shown why it's 25%. And the 25% does not change after the first child. The
Okay.
25% applies to each childbirth. Okay. Someone
Wow.
said, does childbirth reduce lifespan of a sickle cell patient? Not it doesn't reduce the lifespan, but there's increased complication from
Wow.
childbirth.
Wow.
In
Okay.
fact,
So,
in
what
the
do you
past,
advise?
yes, in the past, people who have sickle cell disease are usually advised not to have children.
Wow.
But I wouldn't say that's the recommendation these days. These days, it depends on you and your doctor. It's something that has to be planned definitely. You should, as a young woman who has sickle cell disease, if you're sexually active, please be on birth control because you want to control when you become pregnant. It can be fatal to you to be pregnant at the time when your sickle cell disease is not well managed.
Okay. Now back to our own questions. How does sickle cell cause stroke? You know, you were saying something about it earlier on, but
Yes.
can you expatiate, go deep into it?
Honestly, it's not a long explanation. The reason why people have strokes in the non-sickle cell population is when there is something called, it's either a thrombus causes it or the blood vessel is weak and there's an aneurysm or even just a rupture of the vessel, and that which can cause hemorrhagic stroke, meaning that there's blood bleeding into the brain. And the more common one though is a thrombus going into the blood vessel in the brain and blocking it and reducing blood supply to a part of the brain, which will cause that stroke there. Now, that happens in people who are older in the non-sickle cell population. People who are older, people who have had cholesterol problems that have not been controlled, people who have propensity to have blood clots It can happen in those people. But in sickle cell patients, it can happen in a much younger age, because from the start, like I mentioned before, there is that blockage of blood vessel by the abnormal red blood cell, by the sickle red blood cell. The normal red blood cells are stacked when they're moving in blood vessels that are small. God is wonderful. God created us wonderfully. So red blood cells normally would stack in such a way that is to allow for a laminar flow of the blood, even in very tiny vessels, right? So they just keep moving along like that, even though they're in tiny vessels. But when there's a sickle cell that is, it's like an S shape, it doesn't stack like that. And what happens is that even when there is especially when there is dehydration and there is other stressors, it makes it even stack worse, and it's not aligned, and basically this causes those blood vessels to be blocked, and it can lead to stroke. So but the important thing to tell anyone who has sickle cell disease who is listening, or who has a child with sickle cell disease who is listening, the important thing is your follow-up again. And why does this directly apply? There is something we do to screen for probability of a stroke happening. We do what is called a transcranial Doppler. Is that what it's called? Hold on. Sorry, I haven't said these words in a while. Transcranial Doppler, exactly. And what does that mean? It means that an ultrasound of the blood vessels in the head to see how the flow of the blood is. If the flow is good, the likelihood that this child is going to have a stroke is low. If the flow is not good, then we know we need to do some things to help to reduce the percentage of sickle cells that this person has, because they can have a stroke. So it's a screening test. It doesn't mean that if you have a normal transcranial Doppler, you're not going to have a stroke. It doesn't mean that if you have an abnormal one, you're definitely going to have a stroke. It's a screening test that people do at follow-up to screen that, okay, we need to do something, or we don't need to do something. And usually that intervention is hydroxyurea. I know that's something we do in Nigeria. Before I left Nigeria, we should do that for patients. We'll give a child hydroxyurea, even if they were not on it before, if they have an abnormal or a transcranial Doppler that is showing a high likelihood of having a stroke. So I hope that was helpful. I'm not trying to scare us about the stroke part. I'm just trying to let us know that there are things that are done to prevent these things, or to help prevent these things.
Yes, you are actually enlightening someone like me, who is even a sickle cell patient. You don't even understand. I did not know half of this. I can assure you.
Absolutely. I'm glad to help.
Okay. Someone is asking, can a child's genotype be treated during pregnancy?
Unfortunately,
is it possible?
Unfortunately, no. That can't be done. Now, there are parts of the world where what's it called now? I'm trying to remember the word for when you choose to do something as opposed to spontaneous. When basically people can choose to do abortions at certain times at certain periods of pregnancy, first trimester basically, and early first trimester. So if someone thinks that they may have a child with sickle cell disease, and just to segue into that, let me start from here. So over here in the US, whenever we have a pregnant woman seeing us at the office for to establish care for her pregnancy, our antenatal clinic, one of the tests we do is to check the genotype.
Yes.
Especially if they're Black. If they're not Black, we may not care. If they're Black, we know that Black people have a high. I can talk about the epidemiology in a little bit, but Black people have a high rate of sickle cell carriers, right? So if the mom is AS, even if we don't know the father, we'll send that mother to go and do something called I can't remember words today. These are words I use every day at work, and I'm not remembering them. Anyway,
I
basically, what they do is
understand totally.
they go into the baby's amniotic fluid and take a sample and test it to see if this baby is AS or SS. And in countries where people can do early first semester abortions, then they go ahead and opt for that option because they don't want to bring a child with sickle cell into the world. Yeah. I see a question. Someone says, "Are sickle cell and thalassemia the same?" They are not. Um, they're both problems with the hemoglobin, but thalassemia is different. The things that cause them are different. The populations that have them are a bit different. Even though thalassemias are also more common is more common in Nigeria and other parts of the world, but it's also common in other parts of the world as well. But thalassemias are not when thalassemias are compatible with life, meaning if a child is born with a thalassemia and they escape that being the baby and they have thalassemia and they're able to be born, they usually do well. They do okay. Sickle cell disease affects people more than thalassemia.
Okay,
Testing the
Sumi is
baby
asking a question.
Does testing the baby's amniotic fluid not cause miscarriage? There is that risk, but the risk has been reducing more and more since the procedures. There are different procedures. There's a procedure of testing the amniotic fluid. There's a procedure of testing the baby's, of taking a blood sample from the cord in the belly, in the mother's belly. You go in and take a blood sample from the baby's cord. So there are two different procedures and they have different risks. The one of taking the blood sample has more risks, of course. But these risks are relatively little, they're small, and with improvements in techniques, they're getting better.
Okay. Wow.
Someone said pro-choice. Yes, my personal opinion, I do agree that this is why we need to be a pro-choice country, because there are diseases like this
Yes.
that depend on this kind of decisions, and we have to let a woman be able to decide if she's going to bring a baby into the world with sickle cell disease or not.
Okay. Our last question from this end. I don't know about our viewers. In the US, how common is sickle cell disease? Because you were saying something about the African Americans are the ones having it, who have it, or I don't know. Can you explain to us so we understand?
So the total incidence of sickle cell disease in the US is put at about 100,000.
Okay.
And the population that have it is basically African Americans, mainly African Americans. I want to say 20%. Let me see. I think I have that number just laying somewhere around here. Okay, so about 1 in 13 African Americans in the US have the sickle cell trait, not the disease. About 1 in 365,000, I think, have the disease. No, 1 in
Wow.
60,000, sorry, have the disease. Hispanic Americans are also prone to having the trait, but they have it much less in that population. Someone said, "What about bone marrow transplant as a
Bone marrow
cure?"
transplant as a cure. Yes.
So that's what I said. That's what I meant when I said hematopoietic cell transplant. So that's what they do. It's called a stem cell transplant. It means transplanting precursor cells.
Okay, so what are you trying to say? The bone marrow transplant, are you advising that people who can do that should do it?
Um,
Ex-
depends on the availability, how expensive it is as well. It's not a
Yeah,
cheap procedure, and it's not
it's not.
available everywhere. So, and it also has its risks, and there's also another thing to consider is its success rate. So, I don't know off the top of my head how expensive it is. Also, it'll have different costs in different places,
Wow. But
but I know
but
it's
do you think
expensive.
but do you think having a bone marrow transplant can help a sickle cell patient? At least let there be something that people can lay their
Oh
hands on.
yes. Oh yes,
Like ease.
absolutely. Having putting a bone marrow transplant is helpful. I don't know if it's directly called a bone marrow transplant, but I know it's called the hematopoietic stem cell transplant. That transplant does help a lot. It, like I said, I was saying before, I don't think it's called a cure outrightly, but it does it makes the ratio. Like I said, the important thing is the amount of normal red blood cells versus sickled red blood cells that the person has at any given time. And that ratio is recorded in your like your doctor will check that ratio as a child who has sickle cell that's following up. We will check that ratio and and keep in our chart. Okay, this person has this ratio. Then we need to be more proactive about treating this person. But to answer the current question, that transplant increases the ratio of normal red blood cells that there are and reduces the chances of having those diseases greatly.
Okay. We'll be counting down very soon, but I want to ask one question, please. As sickle cell patients from growing up as a baby, why is it that some sickle cell patients die at, I don't know, during childhood, they die as a baby, die at 15, die at 25, die. Some can stay very old. Why? Is it that spleen you are talking of, it's already, I don't know, the spleen is already cut short? Or what
So
is it? I
I'll
don't know.
answer the question about this. I'll answer the question about the spleen first. People can live
Okay.
without a spleen.
Wow.
People can live till old age without a spleen. It's a matter of having your immunizations and preventing infection, and if you have an infection, treating it appropriately and knowing what kind of infection you're prone to. But to answer your other question, why do some people die early and why do some people die later? A couple of things that affect factor into that. Availability of healthcare, whether or not they're seeking healthcare, whether or not they're following up, whether or not they're adhering to the treatment. And unfortunately, some people just have a higher ratio of the abnormal red blood cells from time, from from when they were young, maybe it wasn't caught early, and different reasons. Now, for babies that pass on from sickle cell, that's something it can be prevented because what needs to be done at that point is if a baby is born and they're having, first of all, when a baby is born, for the first couple of weeks and I want to say months, they have the mother's blood cells.
Wow.
So they won't have that present. They won't you won't know they have sickle cell disease if they've not been tested for it or if there was no um you know if there was no knowledge beforehand. In fact, if you test them for it, you may not even know because they have the mother's red blood cells. They're still producing like what we call fetal red blood cells, and they have some mother's blood, and that fetal red blood cell is protective up to a certain time. Now, when they present as, I think the earliest I want to say is not the earliest, but typically usually around 3 months or 6 months and then on. they usually present something called hand and foot disease, where the hands and feet are swollen. So our doctors in Nigeria know about this. That when a baby comes and the hands and feet are swollen, it
Yeah.
you a lot most of the time it's from sickle cell
So,
disease. So
wow.
that they have that awareness there, and we have that thought, at back of our mind, and we'll quickly move on to what the treatment options are. We can do, we'll give them fluids, we treat the pain, we can do exchange blood transfusion from them, take some blood out, give them some normal red blood cells, and, treat infection, and counsel the patient's parents from then on.
Okay.
And for people who are younger who pass on from sickle cell disease, unfortunately, it's better controlled in some people than others. But even in people who it's difficult to control it in, it's still very much possible to control it well. Now, some people have complications that are life debilitating. Some people have their kidneys shut down at an early age from sickle cell disease.
Mm.
Unfortunately, that becomes very difficult to manage. That reduces that makes the prognosis poorer, and it can be dire.
Okay. I think this question might be the last one because we are fast spent, as in our time is almost up.
Uh-huh.
So the person is asking, what's the potential life expectancy after the stem cell or bone marrow transplant?
Transplant.
Can you
That's a
please say?
very important question, a very good question. And unfortunately, I don't have that answer for you right now. Um, the uh, I can look it up, but what I can tell you is that for that kind of procedure, the whole point of doing it is to prolong the life expectancy. If it's not going to
Yeah.
prolong your life expectancy, no doctor is going to put you through it. It's
Mm.
not an easy thing on the patient's part as well. Those transplants are difficult and they're painful.
Yeah.
Yeah. So if it's not going to prolong the lifespan significantly, nobody's going to make you pay for it or make you do
Mm. Okay. Dr. Yemi, before we go, can you give your advice to sickle cell patients and also to their family members, their friends, relatives, neighbors, colleagues, employers? Please
it.
just talk to people. People need to, I don't know, they need to be more aware about this sickle cell disease and know that people with sickle cell anemia can live a normal life. You get me? Please, just
So
to wrap it.
my my first thing I want to say to everyone is we're in information age, and there is information out there. There's information available for everyone to use. Just please go and read about it. And when you are reading about it, don't go to just any website. A lot of people publish a lot of things about sickle cell. Survivors
Okay.
who don't have all the information that may not apply to other kinds of sickle cell patients. So read from I want to say verified websites. I don't know what that would mean. Um, you can read articles from that are published by researchers and doctors. You can read
Okay.
things from this the CDC, for example. Um, so that's the first thing. The next thing is that it's a disease that has terrible implications, and